Continuing with Chapter 6, Objective 4, now we're going to define, pronounce, and spell surgical terms related to the urinary system. This slide just shows just a handful of the surgical terms, but your book has more of them, so let's get started. These, again, are built from word parts, so again, prefix, suffix, word root. Cystectomy, excision of the bladder. Cystolithotomy, incision into the bladder to remove stones. Cystoscopy, suturing the bladder. Cystostomy, creation of an artificial opening into the bladder for urinary drainage. Cystotomy or vesicotomy both mean incision into the bladder. Lithotripsy, surgical crushing of stone or stones using shock waves. Myototomy, incision into the meatus to enlarge it. Nephrectomy, excision of the kidney. Nephrolithotomy, incision into the kidney to remove stone or stones. Nephrolithotripsy, surgical crushing of stones in the kidney using shock waves. Nephrolysis, separating the kidney from other body structures. Nephropexy, surgical fixation of the kidney. Nephrostomy, creation of an artificial opening into the kidney. Pyelolithotomy, incision into the renal pelvis to remove stones. Pyeloplasty, surgical repair of the renal pelvis. Ureterectomy, excision of the ureter. Ureterostomy, creation of an artificial opening into the ureter for drainage of urine. Urethroplasty, surgical repair of the urethra. Vesico-urethral suspension, suspension pertaining to the bladder and urethra. So this picture, again, they're just listing some of the common surgical terms built from word parts. This diagram is showing the creation of an artificial opening of the bladder, so that would be a cystostomy. And so the correct term to label this diagram, so again, they're giving us the term incision of the renal pelvis, of course, to remove a stone. And so the only differences on the two options we have are the suffixes. One has O-S-T-O-M-Y and the other one is O-T-O-M-Y. And so hopefully you are choosing letter B as your answer, because otomy would be the suffix, the definition would be incision. Sorry, I cannot talk right now. And then the opposite would be creation of an artificial opening into the kidney, which would be the O-S-T-O-M-Y suffix. Here's a percutaneous nephrolithotomy. So you can see the stones that they're trying to break up. So per is a prefix, means through. Cutano is a combining form meaning skin, and then the OUS is a suffix meaning pertaining to. So there it is analyzed for you, pertaining to through the skin. And then nephro is a combining form meaning kidney. Litho, another combining form meaning stone. And then again, otomy is just easier to say, but tomy is cut into or incision. So here it is analyzed completely, so incision into the renal pelvis to remove stones. And now let's look at the surgical terms not built from word parts. Again, lots of exercises along the way. And so there's actually only 3 surgical terms not built from word parts that we're going to cover. So the first one, extracorporeal shock wave lithotripsy. Non-invasive surgical procedure to crush stones in the kidney or ureter by administration of repeated shock waves. Fulguration, destruction of living tissue with an electric spark, a method commonly used to destroy bladder growths. And renal transplant, surgical implantation of a donor kidney into a patient with inadequate renal function. And then here is a picture of the bladder fulguration, of course, in a male patient, and that's the same picture in your book as well. And that will end this recording.